Cervical cancer is fourth among cancers that affect women in the United States. Additionally, the Centers for Disease Control and Prevention, CDC, report that 4,000 American women lose their lives to cervical cancer each year, with 11,500 new cases being identified. Given that cervical cancer is one of the most preventable malignancies in women, these figures are startling. There is, however, positive news. Over the past 50 years, there has been a consistent decrease in the incidence of cervical cancer. The American Cancer Society reports that cervical cancer is infrequent in women under the age of 20, and most frequently diagnosed in those between the ages of 30 and 44. Regular tests are crucial because cervical cancer, also referred to as the silent killer, frequently shows no symptoms until it progresses to an advanced stage. HPV, a common virus that can be spread from person to person through sexual contact, is the cause of almost all cervical malignancies. One of the best methods for testing women for HPV infection and cervical cancer is the Pap test, also known as a Pap smear. It's crucial to be aware of any potential warning signals, in addition to getting screening tests such as HPV and Pap tests on a regular basis. These are 5 typical signs of cervical cancer. 1. Abnormal vaginal bleeding. While many women experience sporadic, irregular periods or spotting, any changes that are unusual for you may point to a more significant health issue. Vaginal bleeding that is uncommon for you, such as bleeding during or after sex, in between periods or after menopause, or having longer periods than usual, may be a sign of advanced cervical cancer. 2. Unusual discharge. Although vaginal discharge is typical, the kind of discharge you get may be a sign of vaginal health issues. Cervical cancer can cause a foul-smelling discharge that might be pink, brown, or crimson in hue. Distinguishing between abnormal discharge, indicative of cervical cancer, and the myriad of other possible causes can be challenging. This is just one more justification for getting regular testing to rule out any major conditions. 3. Painful sexual intercourse. Tumor growth in your tissues and reproductive organs might cause pain during sexual activity for women with advanced cervical cancer. Numerous other factors can also contribute to pain during sexual activity. 4. Pain in the pelvic region. Although menstrual cramps are a typical issue, pelvic aches and pains can also be caused by other factors. Pelvic pain that doesn't coincide with your regular menstrual cycle could be a sign of an issue. The discomfort may be localized in one spot or distributed throughout the pelvic region, dull or acute. In any case, pain is the body's alert system going off. 5. Complications in bowel movements. Women with cervical cancer may have changes in their bowel and urine habits. Your desire to urinate may become more frequent and intense. And if the nature of your stools changes over time, it may indicate that the cancer has progressed to your kidneys, bladder, or colon. It's crucial to discuss any concerns you have with your doctor, because many cervical cancer symptoms might also resemble those of other, less dangerous illnesses. With the HPV vaccine, routine screenings, and prompt and proper follow-up on abnormal results, cervical cancer is highly prevented. If you're unsure if you need to be screened, discuss your concerns with your physician.